You know, the adverse effects of Obamacare, we've talked about them. We couldn't have possibly covered all of the adverse effects. Some of the adverse effects we don't even know about yet. You know, you got to pass the bill to find out what's in it. Well, we found out much of what's in it. Some people have done yeoman's work in talking about this, and we welcome in our next guest who are among that list of people. Dr. Scott Gottlieb, American Enterprise Institute, practicing physician and former senior public health official, joins us. Hello, doctor. How are you?
Good, thanks. Thanks for having me.
Well, it's my pleasure. And I was really taken by a piece, that appeared a couple of days ago, or maybe it was last week, about the effects of Obamacare on people who have cancer. And, there's all kinds of effects. I mean, I think back, my mom, she just celebrated her 86th birthday. She got leukemia out of nowhere, like most people get cancer, I guess, 2 years ago with no family history. No one in our family, immediate family, had ever had cancer. Anyway, long story short, she underwent treatment. Thank God she's fine. I don't think she would have been allowed to have that treatment. But that aside, under Obamacare, but that aside, you bring up many other points that speak to why people with cancer are going to be hard hit under Obamacare.
Right. It's anyone with a rare condition or a condition that requires specialized help, but that includes many cancer patients. And so I think this is going to hit cancer patients particularly hard. And the issue is that the president talks about the insurance market reforms where they're going to cap out-of-pocket expenses and things like copays and how much of the cost of care patients are responsible for as a result of Obamacare. But that only applies if you stay within the network decreed by your plan. And what we know about the Obamacare plans, everyone now acknowledges, is that they're going to be what we call very narrow network plans, which means you're going to have a very limited menu of options of physicians to choose from. And so if you go outside that network, outside the menu that's prescribed by your Obamacare plan, there is no limit on the out-of-pocket cost, no limit on the cost sharing, the copays. You could literally be stuck with the entire bill. And there'll probably be some plans that do that charge patients almost the full cost if they go outside their network. And so what's going to happen if you, God forbid, get cancer and you want to go to Memorial Sloan Kettering or the Hutch or MD Anderson, or you want to get a second opinion from a specialized physician or get treated at one of those institutions, if those institutions aren't in your plan, and they're very unlikely to be in your plan because those are high-cost institutions that most of the plans are going to avoid, you're not going to be able to go to those institutions unless you're willing to pay the full cost out of pocket or something pretty close to the full cost. It's really going to limit the options that patients with rare conditions that require specialized care have to choose from. There's other provisions in the bill as well that hit cancer patients.
Yeah, and I want to talk about those, but let's talk a little bit about what kind of money we're talking about here. I mean, if people had to pay out of pocket.
Well, it could, if you look at a course of treatment for a patient with a blood tumor, if you are using some of the more expensive, the newer drugs, you're requiring some radiation oncology, you could be literally talking about $100,000 or maybe more for a full course of treatment to try to achieve a complete or partial response to the cancer. If you go outside your network to get that care, if you want to go to one of these specialized institutions or an institution or a doctor who happens to be outside your network, there's no limit on what the plan can charge you. The only place where there's a limit in Obamacare on the out-of-pocket spending that you can be hit with if you go outside your network is in the emergency room. So if you find yourself in an emergency room of a hospital that's not in your network, there they place limits on how much you can get hit with. But most people are used to insurance plans right now, the old preferred provider organizations or even HMOs, where if you go outside your network,
right, you get 60% or something, right?
Right. It costs you more, but you're not saddled with the whole bill. What we're going to see in the Obamacare plans is patients are going to be saddled with a much, much higher percentage of the cost, and in some cases it could be the full cost.
Well, this is an outrage, and of course this flies in the face of everything we've been told. Talk about some of the other problems with this if you're a cancer patient or have another rare, as you put it, rare disease.
Well, what they're rolling out is protocols to try to sort of dictate what kinds of treatments patients should get for certain more common kinds of cancers. We're going to see these become much more common in these Obamacare plans, where there's prescribed menus of options and clear protocols on how patients should be treated for some of the more common cancers, where there are admittedly some accepted approaches. But in some cases, certain patients want to deviate from those approaches for specific reasons, and it might be because they're choosing a drug based on a side effect profile rather than, just which drug might be the most efficacious. Those opportunities are going to be limited. We're also going to start seeing the administration try to what we call bundle the payment for certain kinds of cancers, where they give doctors or provider organizations a lump sum of money to take care of patients with certain conditions. So the patient who comes in with early stage breast cancer or early stage colon cancer, the provider is going to be given a lump sum of money to take care of that patient. That's going to give the providers a big incentive to try to economize on what technology they use in treating patients, because whatever money they spend in caring for the patient is coming out literally of their own pocket. This is really a throwback to the old HMO model. It's a form of capitation, but the administration is pursuing this hard as its primary cost containment tool in Obamacare.
This is, I swear, even people who think they favor this, they don't have to, and we have a minute, but do you think people know? Do you think we're ready in this country? Forget the train wreck of administrative train wreck and privacy concerns and all. I'm talking about people who are sick and need help getting the help they need. Do you think the people in this country even have a clue of what lies ahead?
Well, what people certainly don't realize is how restrictive the Obamacare plans are going to be. Everyone in Washington knows this now, that these are going to be very narrow network plans. You're going to have a very limited choice of providers to choose from. I don't think the average consumer realizes that yet. They're not going to realize it until they start seeing these plans and people start enrolling and realize how limited their options are.
Yeah, it's very, very frightening. And, of course, the goal is, I believe, to have everybody enrolled in those plans and knock the other insurance companies out of business. Dr. Scott Gottlieb, American Enterprise Institute medical expert, thank you so much, sir. We'll speak to you again.
Thanks for having me.
Take care. Well, there you go, folks. Just don't get sick. Yeah, that's what Obama would tell you. Don't get sick. Then you won't need Obamacare. Oh, thank you, Dr. Obama. Thank you very much. Because that's what it's going to come down to, folks. That's what it's going to come down to. God help you if you get sick in the United States of America under Obamacare. All right, folks, we're coming back. Malzberg's Media Madness with Noel Shepard of Newsbusters on the Steve Malzberg Show, Newsmax TV and radio.